It's brought to you by allaboutmqm.org, the MQM's knowledge base.
I didn't know about this disease and it was 1 year back when a reporter from Daily Times highlighted this story, and he asked me about this disease, and then we discussed it for quite some time. And then our team from the Provincial Health Department and the team from the city district government visited the site, and they have met all these three families. There are three different families which you have shown in your documentary as well. And as far as diagnosis is concerned, now I have seen that all these three families, and it was also the feedback was also given from my department and the city district government that these three families are suffering from three different sort of diseases. One family, the father who was shown in this documentary, he is Hussain, and his family is suffering from muscular dystrophy and cerebral palsy. So it's a sort of diagnosed case. And other is also a fisherman family whose 4 children are affected, and they also have developed paralysis in their lower limbs along with mental retardation. So the problem is that it mostly seems to be genetic sort of disorder, and what we can do.
So the problem is, though, that this seems to be too much of a coincidence amongst a whole community and an entire generation of youngsters.
It's not a sort of coincidence. Actually, one family resides in Ibrahim Goat, and the other resides some 9 kilometers away from there. And I visited the two teams. There's a difference in there. If you talk about the medical terms and the disease, there is certainly some sort of difference, and both the disease can be labeled as a different one. But as far as for the common person it is concerned, yes, it is a disorder, and common, or on one headline I can say that it is a sort of neurological problem. And the third one, whom you've shown, the 4 girls who have bowing in their legs, is a sort of rickets and vitamin D deficiency disorder. So what I have seen there, that there are multiple factors which are striking these families along with poverty, that they are facing genetic disorder due to some sort of intermarriages for some few generations in the past. And along with it, I have also observed that there are some nutritional factors. Unfortunately, what I have observed is that everyone there have emaciation, and the body is wasted, and no one is in proper condition.
We're talking about not being able to afford to buy food, yes. So malnutrition obviously plays a huge part. What I meant by coincidence is that these people seem to be concentrated within one community or one particular area, as our report showed.
Yes,
so has any investigation been done to find out if there is one common denominator? For example, has there been any water testing? Because a lot of these people's livelihoods are they're fishermen.
As far as testing is concerned, we have been in touch with different scientists as well. And one professor from who is Dean of Environmental Sciences is conducting a test, and she has taken this study, and she is conducting a study on it, and has taken 4 criteria in which nutrition, genetics, water samples, and contamination of the waste from industries. She is conducting a what I can say, study on it in Karachi University, and these are the 4 things we have conducted. We have taken water samples before my visit some 3 or 4 months back, when again this story was highlighted, and yes, there is contamination in the water.
What kind of contamination?
There is a huge amount of those particles which are usually discarded in the industrial effluent and waste. And the area near this vicinity, I have observed a lot of waste which is usually coming from the industrial area. This can be caused, but as far as genetic disorder is concerned, one can't label only the industrial waste as a cause. There are some other factors, but
okay, so as you said, there's a number of factors involved, but if we take a look at water contamination for starters, what's being done? If you've now discovered, as the health minister for this province, you've discovered that water's being contaminated, what's being done to stop that contamination?
Yes, basically, what I have done today, first of all, I have tried to meet the families who are the victims, and I have been fortunate to see some of the patients today. And we have started a strategy for them, so that they will be some of the 4 children have been shifted now to the Civil Hospital Karachi in the Peds ward, so that we can evaluate their causes and what we can do. And along with that, we have also chalked out some sort of plan that Ricketts patient will be followed by Professor Zulfikar Bhutta. Along with it, as far as water contamination is concerned, I have conveyed this fact to the district government and the town as well, that we will have to look into it, that how we can improvise the conditions so that pure water can be available for the common people over there. This is what we can do, and we have conveyed it to the district government as well, so that EDO Karachi was along with me, and I have conveyed it. So definitely I will write it to City Nazim as well, that what steps and measures we have to take in. We have to take, cause although this town is it comes under, this vicinity comes under jurisdiction of Ben Qasim town, but I think City Nazim will have to take some measures.